Over the last few years, we've definitely seen a real shift in the public's understanding of loneliness and political interest in tackling the issue too. It's always interesting to reflect that when the Red Cross first started advocating for national government action on the issue, only back in 2015, there were pockets of great initiatives locally, but loneliness was largely absent completely from the national agenda. Yet, loneliness is now seen as a major public health issue by governments across the UK. We've seen strategies in Wales, Scotland, England, various funds, and an ongoing investment in growing the evidence base. When you think about the scale and the impact of loneliness, it's not actually that surprising that governments are increasingly recognising that we need to do something about it. Millions of people of all ages and from all backgrounds already felt often or always lonely before COVID. And the pandemic has made it worse for many. Almost 30% of Welsh adults have told us that they hadn't had a meaningful conversation with someone in a fortnight during the pandemic. And a similar proportion are concerned that their loneliness will only continue to get worse. We know that some communities, usually those already in vulnerable situations or going through other big life changes, have been impacted much more than others. People who are disabled, people experiencing financial hardship for the first time, people experiencing a new mental health condition. We also know that loneliness isn't good for our health, well-being, productivity, and resilience. It's linked to an increased risk of a range of health conditions: Alzheimer's, stroke, sleep problems, depression. And Red Cross research has found that people who are reporting to be lonely right now are much less likely to feel that they can cope and that they will be able to recover from today's pandemic. But the fact that loneliness can touch almost anyone and affect almost everything can sometimes make the idea of addressing it feel overwhelming. But while there is certainly no silver bullet solution to loneliness, the solutions are actually much simpler than people think. For example, through our own social prescribing link worker services, we've seen just how far simple, one-to-one, person-centered conversations and a little bit of trust and time can go into building people's confidence and independence and encouraging them to connect. Of course, though, social prescribing is only one piece of the puzzle. For initiatives like this to work well, we need a whole ecosystem equipped to support connections. People need access to technology for information and advice. They need transport to get to places, and many need a thriving voluntary and community sector to provide the types of community activities and events that they might rely on in the future to meet other people. When thinking about policy and practice solutions, I always find it really helpful to break it down and think about loneliness as numerous drivers which take place at a range of levels. So at an individual level, someone's sense of self, their health, income, and habits can all impact our connections. At a community level, things like a lack of available, accessible, and affordable social activities, spaces can contribute to loneliness, as can things like inadequate transport infrastructure. But we also know features of UK society can play a role, such as social and cultural norms like stigma, prejudice, discrimination, as well as the rise of online and digital engagement. When we think about it in this way, it's clear we A, all have a role to play in tackling it, and B, collaboration across organisations, sectors, government departments, and communities is absolutely essential. But of course, loneliness is not always on the top of everyone's priority list. But I think we have a real opportunity to make it so right now. Many people recognise the importance of strong relationships more than ever due to COVID. But we need to be smart about what happens next. From a Red Cross perspective, there are a few opportunities in Wales that we think we should influence to turbocharge the agenda and work towards a truly connected recovery. In the immediate term, there's a strong case to be made to invest in confidence building and reintegration support for people who've been particularly isolated and impacted by COVID, particularly now with restrictions easing. This speaks to the programme for government's commitment to introduce an all-Wales framework to roll out social prescribing, which will also need to influence to ensure key insights about loneliness inform its design. And finally, we need to do more to overcome the structural and cultural barriers to connection through, for example, improved transport and investment in public places, and of course, closing the digital divide that has been so tragically exposed throughout the pandemic. Importantly, there are hooks in the current programme for government to drive these forward. A transport strategy and commitments to enhance green spaces, for example. And there's also a digital strategy too. We now just need to work together to make that happen in practice.